So
That's
please
sure.
listen to this episode multiple times. Listen to it with your partner and implement as much as you can, and know that there is support by a pelvic health physical therapist. I have a directory on my website, instituteforbirthhealing.com. Please check it out.
40 weeks for men. 40 weeks for men. 40 weeks for men.
But how do we as dads prepare for birth? Yeah.
Okay. So I would encourage all dads to be as educated as you can on the birth process so
Yeah.
that you can help understand those early signs of labor. You know when things are starting to get more intense, and you just have a sense of that the the pathway of labor, I would say, because it's really exciting when you get those first early contractions and you're like, oh, is this it? And
Yeah, it's
oh my gosh,
happening.
right?
Yeah,
And
yeah.
as a partner supporting someone in labor, I think it's important to help your partner to take it easy those first couple of contractions at early labor. The thing about birth is we don't know, especially first time births, we have no idea how long this event is going to be. It could
Yeah,
be as
good
short
point.
as
Be
7 or 8
short.
hours. It could
Yeah,
be 40 plus hours,
good point.
depending, so it's very exciting to get all excited and, oh, it's starting, and moms will then, or pregnant people will then, like, oh, I gotta clean, I gotta do all this stuff, and it's like, I would encourage your partner to just rest,
Mm,
to know that, we don't know how long this is going to take, and let's take it easy, and let's not overexert yourself so that you can
mm.
have energy for the time when you need to be pushing a baby
Yes,
on
you
out.
need to push. Yeah,
And
good
so
point.
that's the first key, is to, understand what the birth process is like. And I
Yeah,
did an interview once with a
tell
midwife,
me.
and I love this. She talked about the sounds of labor,
Sounds of
and
labor.
the sounds of labor
Tell
from
me
the
about the
birthing
sounds.
process. Yeah. When you're in early labor, your partner can talk and can communicate, and they're very social. But when the intensity of the labor starts to kick in, their contractions get more intense. They start withdrawing and going within,
Mm,
and they're not able to be as outwardly focused because
mm,
the contractions are really intense, and they really have to focus within themselves to get through those contractions. And
mm.
then I'm trying to remember this exactly, but during the transition time, that's when they're either silent, or
Yeah,
they're starting to do well, they're silent because they're really going in their cave.
inside
So
themselves. Yeah,
yes. And then during the pushing phase, then you start getting all the grunting and the
yeah,
urges, and the,
yeah.
that's the pushing phase. Okay. And so
Mm.
one thing that I would love, I just wish, Chris, I apologize. I wish we did a better job in the hospital
Yeah, tell
with
me, tell me.
supporting pregnant people, because what
Mm,
I let my pregnant clients know is that, look, your uterus just spent all this time trying to dilate your cervix, trying to open it up.
yeah, good point.
And when we get to 10 centimeters, the body sometimes takes a break. The uterus
Mm,
takes a break because it needs to rest
yeah,
to then have the strength and energy to then push the baby on out.
maybe out. Yeah.
And so there's this natural pause that happens in physiological childbirth,
Mm,
that most hospitals speed up that process and don't give the uterus that time to rest, because as
mm.
soon as you step into that hospital's doors, you're on their clock,
Yeah,
and you
good
need to
point.
be progressing to continue to get that baby on out. And if you're not progressing, then they start doing the interventions. And one intervention leads to another intervention, leads to another, leads to
Leads to
another,
another,
leads
leads to
to
another. Mm,
leads to a C-section. And
mm.
so we really ideally need to help avoid any of those interventions, and
Mm,
and ask for dads, for partners supporting a birth.
mm,
Your job is, so your partner in that birth process should not be thinking. Our reptilian brain is what is helping to get that baby on out. We're
yeah,
animalistic. We're animals. Our body knows how to birth. The baby knows how to come on out. And
yeah,
and your partner needs to not be thinking, because if they're thinking, it's taking them out of that reptilian brain process, and it's
yeah,
taking us into the cognitive process, which is
yeah,
not what knows how to birth a baby. So we need to help, you need to be the thinking brain for your partner. And if the staff and the doctors are saying we need to do this, you need to ask the questions of, um, what's the benefit, what's the risk, and what would happen if we just waited.
mm,
Is baby doing okay? Is mom doing okay? Can we just wait
mm,
and buy yourself some time? Buy yourself some time.
mm.
And so
Yeah,
the your job is to be the thinking brain for your laboring partner so that they can
mm,
stay connected and in the process of what's actually happening within their body. Because ideally, if they don't get an epidural, then they can listen and feel to what does their body want to do, because that's that instinctual animalistic part of our brain helping them to position themselves to help the baby to come on out. So
yeah, yeah,
I really train my mamas to, like, pay attention, like, what do you want to do, what does it feel like, what position. And I have to say, on the postpartum side of things, after babies come out, I'm seeing a mom after birth. One of the things I hear so frequently, especially if it ended up in a C-section, is I knew if I could just get on my hands and knees, the baby would have come on out. But
mm.
they were denied that by the labor team.
Okay, okay,
And so it could be because maybe they had an epidural and they had no more use of their legs,
yeah.
that they couldn't get into that position.
There may have been
Um,
reasons, yeah.
yeah,
But I
yeah.
hear you
So
though, because like, yeah, let me just say, I hear you because like a lot of the time we forget that a lot of labor is animalistic and intrinsic. Like we actually have the
yes,
ability to do this ourselves. And a lot of time, us dads that listen to this can actually be the thinking brain for our partners, being the more cognitive person to think about, okay, what should we do this? What should we do now? How do we make the best outcome for baby and mum? And I think it's a really good thing because I think a lot of the time, what I've heard, Lynn, a lot of the time people can just feel, our dads can feel like a spare wheel, just
yeah,
like, oh,
yeah,
yeah, just
yeah.
another person holding the handbag. And
Right, right.
actually, we're more than that.
Yeah,
Yeah,
absolutely. You are that emotional support system for your partner.
yeah,
That's your job, is to help try to offer comfort as best you can. And because the number one thing that I would encourage every single person to do, if you can do it, is get yourself a doula.
yeah. I heard about this. Yeah,
Yeah, so doulas are
you like doulas.
trained.
All right, cool.
Yeah, yes. Doulas are
In the
trained
UK,
support
we
people.
call it different. We say different
Oh,
thing.
what do you call, what
In
is it?
doula is like a community midwife in the UK.
Oh,
So
okay. All
community
right,
midwife.
cool.
So a doula is like a person that will help you give birth at home in these states, right? Yeah.
No,
In the
the
UK.
doula is someone who just supports you during your birth, no matter where you birth. So
Okay.
so it's a person who's specially trained just to be more of the emotional support
I wonder if we
part.
have that in the UK. I think we do, you know. I think community
I think
midwives do that.
they're
But
worldwide. Yeah, they're
the doula
worldwide.
will come into the hospital if you need them to.
Yes. Yeah,
Right.
and so the thing is, the doula, a good
Mm,
doula, will help you as that partner be a rock star for that birth.
mm.
Okay. So as a dad, I started off saying you need to know as much as you can about birth. Well, this is your first time. You can't
Yeah.
know everything. Okay.
Yeah.
But a doula does. A
Yeah.
doula
Good
has
point.
been to many other births before. So they can help you be a better support to your partner so that your partner can have as smooth of a birth as possible.
Yeah.
So
Good point.
that's I would highly recommend everybody get a doula for their birth because the
Yeah.
doula is kind of that liaison between you, the partner, your birthing partner, and the hospital staff or the midwife staff, however you're choosing to birth. That doula is meant to be that support system and can
Yeah.
really help you to be that rock star. And and relationship stuff comes up in birth and your
Yeah. It
partner
does.
may
Yeah.
be there. It's intense, guys. It is very, very intense to push a baby out of your body. It's like pushing a watermelon out of your pelvis, and
Yeah.
it's intense. And your partner is going to be they can be all over the place,
Mm.
and you're not going to know how to best support them unless you have someone there kind of helping guiding you and giving you
Mm.
ideas of the
Mm.
best way to support your client or your
Mm.
birthing partner.
Your
So
birth partner.
um yeah, so that there's more we can talk about during the birth process itself, but what I want to
Yeah.
also add in are some of the things that you can help your partner do prior to even going into labor to help them to set themselves up to have a better labor. Okay.
Yeah.
So the thing is that, birth is all over the place. A birth can be 7 hours, baby comes out very smoothly. A birth could be 3 days long. It could take forever. And the
Yeah.
difference is the positioning of the baby prior to the start of labor. So
That's a big
if
deal.
we want to make sure that we get that baby into the best position possible so that it has the easiest access out. So to help a baby get into the best position possible for birth, it really is the reason some people's births are only 6, 7 hours, others are 3 days long, is what a person brings in their body to a birth.
Yeah.
Okay. So it's the surgeries that they may have had in their abdomen. And the number one
Yeah.
surgery that creates problems is an appendectomy.
Yeah.
If a person has had their appendix removed at any point in their lifespan, it creates scar tissue down in the right lower quadrant of your abdomen near your
Mm.
groin.
Yeah.
And it causes that uterus to get pulled and tugged off to the right hand side. And then the baby is only inhabiting the right side of the belly.
Mm.
So if you can ask your partner, is the baby able to get on both sides of your belly? Is the baby
Mm.
only hanging out on one side? If you look at your partner's belly, it should be a nice round basketball in the midline.
Yeah.
But
Yeah.
but some bellies look
Somebody's take off to want to. Yeah, good point. Yeah.
or off to another side, and baby's only on that side. So babies grow where there's space.
Mm.
They go where there's space. So the baby is actually telling you where there's space and where there's not space in their body. And so an abdomen is restrictions in the abdomen and restrictions in the uterine ligaments can cause that baby to only be off on one side. So that's the
Yeah.
first thing we need to be aware of is,
Yeah. Well.
has your partner had any lower abdominal surgeries? Have they
Yeah. You can
had
talk about that as the partner, can't you? As the dad. Yeah.
so this is, I'm just trying to increase awareness of the things
Yeah.
that can cause harder labors for
Yeah.
people. Okay. There is so that's the abdomen. So seatbelt injuries might also cause a restriction. So if someone's been in a car accident and they were wearing that seatbelt low across their belly at any point in their time, there may be some restriction. There may not be, but these are just some things that we want to keep in mind. And now, what you can do with your partner is put your hands on either side of their pregnant belly. And this is best when you're in second, third trimester of their pregnancy.
Yeah.
And you can very gently push the baby as far to one side as you can go, and then gently push the belly to the other side as far as it can go. And it should be even side to side. If it's restricted, you're going to find that it goes way far over to one side and it only goes half as far, or it doesn't go as far as it does to the other side. That's telling you that there's a restriction in some of the uterine ligaments. Okay. And so we want to help get that balance and evenness in those uterine ligaments. And if your partner is not aware of a website called spinningbabies.com, please go check that out with your partner. Go explore it.
Spinningbabies.com.
Spinningbabies.com. So IES at the end of babies.com.
Yeah.
And there's 3 exercises that you and your partner can do on a daily basis to just help keep balance in their body for birth. Okay.
Especially in the end. Yeah, it's good.
Okay. And then the other thing is to be aware of, has your partner had any falls or impact into their pelvis? Fall on their tailbone, fall on their buttock. Were they an ice skater? Were they a snowboarder? Did they slip and fall on ice in the wintertime? All those are things that could impart a force into the pelvic bones that could then just minimize the ability of that pelvis to open for baby to come on through. Okay. So there are pelvic health physical therapists around the world, and
like yourself.
Like myself.
Yeah.
I do have a directory on my website that directory is of people that I've trained. So they are very aware of these concepts that I'm sharing with you today, and they can best support you in preparing your pregnant client's body for birth.
What's your website? Lynn Shulte?
No. Institute for FOR birthhealing.com.
Okay, Institute for birthhealing.com. I'll put it in the description as well.
Awesome.
Right.
There's additional resources in the menu bar. If you click on that and drop down, there's a directory.
Drop down, it'll be there.
So,
great.
Okay. So you can check and see. I'm still getting my work out there, and there's a lot more people that are trained that are not in my directory yet. We're working on that. So just keep checking back or ask around and see who does body work to prepare the body for birth.
Watch this space. Yeah. Watch this space.
Yes.
Yeah. Good.
Yes. Okay. So the pelvis, now the most important piece to the puzzle for birth are the pelvic floor muscles.
Yeah.
Okay. So around that vaginal opening, we have muscles that go from the tailbone to the pubic bone up front. And those muscles, I call them the stoplight for birth.
Stoplight for birth. Yeah.
So if we have red light tone in those pelvic floor muscles, meaning those muscles are really, really tight and they have no ability to relax or open up, that baby is not coming through the pelvis.
Yeah.
If your partner gets an epidural, there might be a chance that the muscles can lengthen, but it's just more hard. It's harder for the baby to come through. If the muscles have been like this and they've never lengthened, they don't have the ability to lengthen, and that needs to happen for the bones of the pelvis to open up for the baby to come on out.
Yeah.
So good tone in the pelvic floor muscles are it's like a trampoline. When you press down on it, they give and then they come back up. So they have that springy quality to them.
Yeah, okay? Springy quality. Yeah.
So this is something that I would encourage you and your partner to work on sometime in the late second, early third trimester, is that if you feel comfortable inserting your in vaginally, okay? And I want you to think about, I know I'm going to tell these partners
Lynn,
how to
you're telling partners to...
I know, because The muscles are so critical for
I'm
birth.
laughing. I'm just a little kid. This
I know.
is good advice.
Okay. So I'm going to instruct you on how to do it, okay, with your
Yeah,
partner.
tell us. Yeah.
So the vaginal opening, think of it as a circle, okay? Think of it as a clock,
Mm-hmm.
that you're looking at that clock. And
Mm-hmm.
at 6 o'clock down at the bottom, that's where your rectum is, okay? So we
Mm-hmm.
don't want to push directly right down in the middle.
Mm-hmm.
You want to come off at 7 and 8 o'clock on the
7
right-hand
to 8
side
o'clock. Okay.
and 4 and 5 o'clock on the other
Yeah.
side,
Okay.
okay? And if you insert your finger all the way in
Mm-hmm.
and you just put that entire finger along the length of that vaginal wall and you press down, it should give and it should bounce back up.
Mm-hmm.
Then go over to the other side and do the same. And that is normal bouncy tone for the pelvic floor muscles. Now, sometimes you may find that there's increased tension on one side and it's nice and springy on the other side. We
Mm-hmm.
want to work to try to get those muscles to strengthen and relax and be even. So baby has that smooth midline passage to come on out.
Mm.
Okay?
It's a good
So,
shout, especially for the hands-on dads and the ones that aren't
yes.
so squeamish and want to get involved. Really good.
Yeah, this is a
Yeah.
great way. So here's the thing. You want to work if there's too much tone in it, I want you to just gently kind of compress on that muscle, just gently push on it. Now, don't create pain, dads. Don't
Yeah.
create pain. Pain is a sign that the muscles aren't happy and that they need more support. Hence, a pelvic floor physical therapist. So send your partner to a pelvic floor PT and have them work together.
Yeah.
If you just press on a muscle that's a little tight, you may notice and have your partner breathe to where you're pressuring on their muscles. And
Yeah.
then just hopefully you'll feel that the muscles just kind of melt there a little bit.
Yeah.
Okay.
Yeah.
Now, the other thing that you can do, we want to have those muscles nice and bouncy and springy and even on side to side. If you can put your finger in as deep as possible. Now, how do you know if it's a muscle or not? Because it's like, it's just tissue. If you put your finger at 7, 8 o'clock and 4 or 5 o'clock, then have your partner contract their pelvic floor muscles or do a Kegel.
I said
You'll
like they're
feel,
going for a poo. Yeah.
yeah, well, so the poo is the pushing. So the contraction is just lifting up and contracting and then
There you go.
relaxing.
Learning
And
something
so,
new.
yeah, you'll be able to contract and lift and then relax. That's a muscle. If it moves, it's a muscle. Okay. So that's how you know if you're on a muscle. And then after you get those muscles nice and even and balanced and they're springy, then I want you to put your finger in as deep as you can on one side of the rectum. And you'll feel this little kind of mound in the midline there. But on one side of the rectum, just reach back as far as you can. Now put your finger, your tip, deeper on that muscle. And then you have your partner practice pushing your finger out.
Oh, I
And
see. Yeah.
okay. And what you should feel is that your finger actually, that the muscle that the finger is on lengthens and your finger actually gets drawn out towards the opening. That is effective lengthening of the pelvic floor muscles. Now, a lot of times what you may find, dads, if you're doing this, as you put your finger there and you say push out, they may contract and tighten the muscle. And that's not what we want. In
No.
fact, that contraction while they're trying to push is the biggest factor that can cause greater tearing in your mom's perineal body and you're in those tissues as the baby's coming on out. So we want to make sure that your partner knows how to lengthen. Now, I actually sometimes will put 2 fingers in. So if the opening is wide enough that you can put 2 fingers in, then you put 1 finger on either side of the rectum. So if you press right down at 6 o'clock, they're going to be like, oh, it feels like I got a poo. And we don't want to
Yeah.
be pressing there, guys. We want to be
Yeah.
on either side of the rectum so that we're on a muscle. And then you want to say, push my fingers on out. And you should feel this relaxation and
And
lengthening
lengthening,
as your partner effectively pushes on out.
right?
Okay.
Okay.
So if you can help your partner prepare and know how to push, that's one
Mm.
of the biggest unknowns. You
The
can
help
go
is
to
so
these,
helpful.
yeah, you can go to these childbirth classes and you can learn how to breathe and stuff, but
Yeah.
actually learning how to lengthen your pelvic floor muscles
Mm.
while you're pushing is critical
Yeah, and
for birth.
I find that it's gonna be really helpful, I think, to a lot of dads is realizing actually you may not get this perfect. And that's
Right,
okay. There's a way
right.
out. The way out is find a pelvic floor
Yes,
physiotherapist, and it's gonna be in your directory, and their website is the Institute of Birth Healing, I think you said. Is that right?
yes. Institute
Yeah,
for
yes,
Birth Healing.
Institute of
Yes,
Birth Healing. Yeah, I'll put it in the description. And
yes,
that's your hands-on and want to get this done. Even if they get it wrong, they can always find a perfect floor
yes,
physiotherapist.
yes, yes. And it's so you can also practice with your partner in different positions. So if your partner's laying on their back, say on the bed, and your fingers are facing down because that's where the pelvic floor muscles are, and you're behind them or you're off to one side. If you have your partner roll away from you, now they're on their side, your
Yeah,
fingers stay on those muscles. And now in side lying, you can have your partner practice that
practice pushing out.
lengthening.
I feel like this is a
Okay.
really good point to tell people whatever happens on the bed, Lynn and I cannot be held responsible. If you guys choose to do whatever you need to do whatever you need to do. Me and Lynn, we're just
Absolutely.
here just trying to help people have better births. But I mean,
Absolutely.
like,
Yep.
yeah, do what you gotta do.
Oh gosh, where the male mind goes. I love it.
I'm
Okay.
sorry, I'm sorry.
So,
I've
no,
gotta
I
say it,
love
Lynn.
it. I know, I know. I love it. And so as a partner supporting the push and the
Yeah,
labor in your
yeah,
partner, um please, if your partner's on your back, on their back, and
in
you're
the
trying
back.
to get them to push and they're just not figuring it out, roll them onto their side and have them practice that position. Because actually, Chris, what I find in my clinic is
Yeah,
pushing on your back is the hardest position for a person to figure out how to push.
really.
It's the hardest. I have so
And
many
that's
clients
what
that
we always
are
do in the
on their back.
hospital.
I know. And how do we birth in a hospital?
Yeah, often
On
it's
our
on your
backs.
back. Yeah, on your
Right.
back. Yeah.
So if your partner's on their back and they can't figure out how to lengthen and push your fingers on out, don't spend too much time there. Get them on their side. And then most people are like, oh, now I get it. Okay. So they're able to do it on their side. Now, with your fingers in side lying and your partner's in side lying, then you can actually get them to get up on hands and knees,
It's
and
really
your
interesting.
fingers just stay internally, stay inside, and they're still
Yeah,
on that muscle. You can just kind of twist along with your partner, get them
yeah.
up on hands and knees, and that position is the position that everybody knows how to push out on.
That's really interesting because obviously my wife and I've had 3 girls. My first
Uh-huh.
girl, she was born on her back and labor was hard. Second
Yeah.
girl, she wanted to change position, but the midwife was like, no. And she ended up being born on the back. Third girl, my wife was like, I'm doing what I want. And she literally gave birth to the girl like almost standing up, like on the
Yep.
knees. But yeah,
Yeah. So on hands and knees, now your fingers are in this position. So your partner's in hands and knees. And
yeah,
then you can actually get them up into tall kneeling. That's
yeah,
where your partner gave birth, right, to your
yeah,
third,
third
your
one,
wife.
yeah,
And so in tall kneeling, you can practice that pushing and lengthening of those
yeah,
muscles
but
in
those
that position.
muscles,
Now,
yeah,
once you get done with all that, now get your partner back in on their back and
mm,
practice there again. And you may find that they have a much more successful way of lengthening those pelvic floor muscles on
yeah,
their back. after they've learned how to do it in those other positions.
In those other positions. Yeah, this is good advice. Really good advice.
Okay. So this is
Yeah.
something that you can do with your partner if your partner's open to this and if you're open to
Yeah.
it. But I have to tell you guys, learning how to push and pushing effectively, whether your partner gets an epidural or not, practicing it ahead of time, your muscles have muscle memory. And so
Yeah.
then your partner can just think about it and the muscles will do what she was training to do beforehand. Okay. So this is just such important work that you can do with your partner to help them learn how to push. Okay. So now the other thing that you all need to remember is that the pelvis, as you get closer to birth, the pelvis is getting really mushy. The ligaments are
Yeah,
softening.
the softening.
The hormones are kicking in so that the pelvis can widen for the baby to come on out. At this stage of the game, you want to make sure that the pelvis stays as balanced as possible for it to be able to open up as easily as possible. Now, what causes a pelvis to get out of balance is the way your partner is sitting. So if you have a partner that loves to relax on the couch at night and they sit on one hip and their legs are tucked underneath them to one side, or they sit on one heel with one leg curled up underneath them, all those create asymmetry in the pelvis. And we want to just avoid that. So if you can help your partner to realize that sitting as evenly as possible on their pelvis and staying symmetrical, so whatever the left leg is doing, the right leg is doing, will keep your pelvis as symmetrical as possible. And it's just so important in those later stages, late third trimester time frame. But if your partner's been doing that and sitting like that throughout their pregnancy, just correcting it at the end is most likely not going to be as successful. So trying to keep your body as balanced throughout your pregnancy is really, really ideal.
And that's
So
something
whatever,
partners can actually take their hands and do, help their partner maintain balance and
yes,
equilibrium is a good word,
yes,
and
and
equilibrium. Yeah,
yes. And the other thing too is with standing. If your
yeah,
partner always stands with one hip out or always
yeah.
stands on one leg, that leg, those muscles activate way more than the
They're
leg they're
gonna be
not standing
tighter.
on.
Good point.
Okay. They're going to be tighter. So we need to help them to find even balance. So if they're going to stand on one leg for a little bit, they should stand on the other leg for a little bit. Or better yet,
Point.
let's stand evenly with pressure on both legs. Okay. So now here's a really great tip, guys. If you are bugging your partner and always nudging them to get off that one leg or to get sit properly on the couch, your partner's going to get irritated with you really, really quick.
Yeah,
Can you see that, Chris? Can you see that
I can
happening?
see
Yeah,
that.
right? Right?
Yeah.
Okay, so here's the key, guys. Here's the
Good.
key. Come up with a signal. Come up with a code word or a touch that means something, okay? And so if, whatever the code word is, pumpernickel was something that my son and I came up with for something, I mean, like, what, it can be as crazy as you want it to be. But what, if you say that word to your partner, it's the cue to your partner to, hey, balance your body
Think
out.
about
Because
balancing themselves. Yeah.
these are all habits. We don't even realize we're doing these habits, but these habits really do impact the birth. So sitting evenly, standing evenly is going to bring a more balanced body to the birth, which hopefully will make it a smoother process for baby to come on out.
Yeah, this is really good
Okay.
advice.
So
So
that's,
good.
and maybe when they're sitting on the couch, you just come in, all you have to do is put your hand on their shoulder. And that's
Yes.
the clue for them to sit,
They
readjust and sit more
realize, no, I
evenly.
need to readjust here. And
Yeah.
really, this
Now,
is what I'm really hoping that people realize when they listen to us, is that dads, you're not a third wheel. You're not just the guy holding the handbag. But actually, there's so much you can do to help your partner prepare for labor, and that'll help you as
Yes.
well, your own mental health, because you're involved.
Yeah. Yes, absolutely. One other really important concept for
Go
everybody,
on.
please share this with your partner, is that a lot of times women's legs swell up during pregnancy. And so
Yeah,
what they like to do is sit on the couch, recline back on the couch and put their legs up maybe on a coffee table or something in front of them.
yeah,
But a pregnant person laying in a reclined position on their back is a setup for a baby to rotate into a posterior position in their belly.
yeah.
So that
Perfect.
reclining back on the couch with the legs up in front of them is going to cause the baby's back to rotate towards the pregnant person's back. So
Mm.
we want baby's back towards mom's belly.
Yeah,
Okay. If baby's back is towards mom's back and their
more
feet are out, and you'll
painful.
see all the kicks out front, you'll see the
Yeah,
pushing and everything. That is not an ideal position to go into birth. Okay.
mm,
Because the larger part of the baby's head is going to be coming through the pelvis. We want the baby's head, we want the smaller part, like where you put the back of your head here. This is
yeah,
the smaller part. This
yeah,
is what should come through the pelvis first.
yeah,
And that means that the baby's face needs to be facing your spine. Their
yeah,
back and their butt should be towards the front.
yeah. Okay.
Okay. So spinning babies is all about babies positioning in the belly. And a lot of OBGYNs, at least here in the state, Chris, are not
Mm.
as aware of babies positioning. And if we're dealing with an OP baby, if you have an OP baby, spinning babies has all these exercises you can do to
Yeah,
help
just the
turn your
OP for the
baby.
people. That's the occiput posterior, isn't it? Yeah.
Yes, yes, thank
Back of the
you. And
head to
that
the back of the
to the back
person.
of the
Yeah,
spine of your
yeah,
partner's spine.
yeah.
And you'll see all the pushes straight out the front, the
That's
kicks.
not good.
Now,
That's
what we
not
want,
good.
no, we want the kicks off to the side.
Yeah, good point.
Okay.
Mm.
So that is telling you where the baby's position is. So please be aware of that. And do not have your partner recline back with their legs up in front of them on the couch, especially later on in the pregnancy. In that third trimester, please try to avoid that at all costs. If they need to get their legs elevated, have them lay down on their side
Yeah, it's
and
a
just,
good point.
okay, because that labor, if baby comes in the occiput posterior position, you are looking at a much longer labor. Okay. So that's why
Yeah,
spinning babies is so helpful for getting baby in a really good position. And this is something fun for you and your partner to
yeah,
really
good point.
look at it. It's like, what's the baby's positioning today? Where are you feeling the kicks? Where are you feeling the wiggles? The
Yeah,
wiggles are
good
the
point.
hands of the baby. And so you can get connected to your baby, like trying to figure out where it is in the
Where they
belly,
are. Yeah, good point.
right?
Yeah,
And so the other thing too is dads, talk to your baby in the belly. Okay.
yeah,
Talk to him while it's in utero. The baby will get to know your voice. And
yes,
and then when the baby is born, it'll instantaneously connect to you because of that voice, that sound. It resonates with you through that sound frequency and it knows that you're its dad. And it's just so
yeah, good
cool.
point.
And so Chris, during if your partner ends up in having a cesarean birth
Yeah.
and you're able to be in that operating room with your partner,
Mm.
if
Cesarean section, yeah, surgery. Mm.
yeah, so if the every hospital is different in how they are doing the surgeries and what they do once baby comes out. If in your hospital they take that baby and immediately put it into the warmer and start wiping it down and cleaning it up and everything, some hospitals are actually putting it on mama's upper chest.
Yeah.
Um, and
Into
so if that's
skin.
the case, skin to skin, If that's okay, no matter where your baby goes after it comes out, Dad, you go with that baby and you start talking to it.
Yeah, good point.
Okay? Because if you've been talking to it in the belly, it knows
Your
you.
voice. It'll
It
know your
knows
voice.
your voice.
Yeah.
And it can help calm your baby down if you just go over and put your hand on your baby and start talking to it. And just like and let it know it's like, wow, that was really rough, baby. That I know that was a tough surgery or tough coming into this world, but you're here and I'm so glad you're here. Talk to the baby.
Yes, good
Don't
point.
care what the nurses and the doctor, anybody else said. You start talking to your baby. So the other thing during labor is this is your job is to talk to the baby and let the baby know what's going on.
Yeah.
Your baby in your partner's belly is a very conscious being.
Yeah.
It knows what's going on. So if baby's in that OP position, talk to it. Say, baby, turn the other direction. We need you to, put your feet over here. Let's get your, and tap mama's back. Get your back over here, honey. This will
Yeah.
make it easier for you to come on out. And then when you're in that birth process and something needs to happen, like mom needs to get Pitocin, let the baby know, okay, honey, mommy's getting a drug that's going to make the contraction stronger. Just so you know, this is what's going on.
Well,
If
that's what you
mom
call it
gets
in the States. Here in the UK, we call it Syntocin. It's the same
syntocin,
thing,
okay,
Syntocin. Yeah.
okay.
Go
So
on,
whatever
sorry.
drug that they're giving them to
Yeah, to
speed up
make the
labor,
uterus contract. Yeah.
yeah, let
Mm,
them know that they're getting
yeah.
it and that this is
It's a good
why
shout.
things are speeding up. This is why things are being more intense. Then, if your partner gets an epidural, talk to the baby and let the baby know that it's going to feel like mom is going away
Mm,
because the epidural disconnects mom from feeling the rest of her body, and baby senses that disconnect. If you can talk to the baby and say, mommy's getting an epidural because it's getting really intense here. Mommy's still here. I'm still here with you, honey. And you're still going to be coming on out, but know that it's going to feel like mommy goes away, but mommy's
mm,
still here. Okay. And have your partner talk to the baby and have you guys connect into that baby throughout the entire process. And then
yeah.
if for some reason you need to have a cesarean birth, talk to the baby and let the
Yeah.
baby know, okay, honey, it's not working out this way. So we're going to have to go to the operating room and that you're going to get cut on out. So know that
Yeah.
this is what's happening and you're okay, mommy's okay. We're gonna get you out.
Yeah, that
Okay?
communication is good. And like it's also traverses because a lot of times some different families may not have the dad in the birthing room, but the grandma
Mhm.
might be there, or the sister, or
Yeah.
even like
Yeah.
another person, a friend, or even it might be a same-sex couple. There's loads of different
Right.
people that like have babies together. And actually, yeah, what you're saying is transferable to all these different people.
Absolutely.
Yeah.
And let your partner know this information so that your partner can do the same.
Yeah.
Your partner should be talking to the baby too. Let the baby know what's going on to it because it's inside there. It doesn't know. All it does is it feels the feels.
Yeah.
Okay. Now, the other important part that you as that partner play in this birth is if you do not like the the personality of the labor nurse or the doctor, you don't like how that person is treating your partner, you have every right to kick them out of that birth room and get a different person.
That is a good shout. Because here in the UK, we have this tendency that I'm generalizing it, but we have this tendency, Lynn, to just be like, ah, it's okay, just deal with it.
Right?
And that's how
I
you
tell you what, yeah, it happens over here too, Chris. The the
so bad.
the energy of
Yeah,
that the people bring to the birth really impacts things.
it
And
does.
if the nurse is being weird or mean or whatever, your partner is not feeling relaxed.
Yeah, so sure.
birth is all about allowing that body to relax, to open, to allow the baby to come on through. And guys, just so you know, I'm thinking of an analogy here, as if you know, hit your finger or your hand with a hammer accidentally.
Yeah.
Do you remember that pain? It's like
Yeah.
having that intensity of the pain, but then making your body relax while that's happening to
Yeah.
you. Like,
Yeah.
that's the intensity of birth. It can be very, very intense, but yet you have to stay relaxed through it. And so you and your partner can really practice, like, talk to your partner and figure out what makes them feel relaxed. Is it when you massage their shoulders? Is it when you rub their hand? Is it when you rub their back? And what you figure out pre-labor, like in your home, may be
Yeah.
totally opposite of what they need in the moment.
Yeah.
So
Good point, actually. It might be
so
opposite. Yeah.
you need to communicate with your partner and ask, how's this feel? Is this helping you to relax?
Mm.
No, it's irritating me. It's, you know, it's pissing me off. Then stop doing it and find something else that does, okay?
Yeah.
That's why you had to have lots of different options,
That's a
because
good
I
point,
had to say, and Chris, I'm sure you have this experience with your 3 births with
So
your
much.
wife, but my 2 births were completely different. I
Really?
wanted pressure, and on the first one, I wanted that pressure and touch on my body, but the second one, I was like, "Don't touch me." So it's totally different, and every birth is different. So what
Yeah,
you
for
did in
real.
one birth may not be helpful in another birth.
As you can probably see, I love talking. I'm a talker.
Yes.
So I was like my wife's cheerleader. I was like, you can do this, darling. I believe in you, girl. You got this. And she was like, you need to stop talking to me. Stop talking. And I was like, okay.
Yes, because remember, sometimes they have to go into that cave. And at some point in the labor, they turn internal. They don't want all that chatter,
So true. Each person is so
right?
different. I think you've got to just ask your partner what they want
Yeah.
and just do it.
Yes.
Yeah.
Now, a lot of times though, Chris, they don't know what they want or they don't
Good.
know what they need. And that's where a really good doula can read the situation
Mm,
and help you to find something that you can do to feel
you can
connected
actually
to your
do.
partner.
Good point.
And
And that's the thing
and
about men. Men, we are doers. We want to get things done.
yes,
And
yes,
if you feel helpless, it's almost worse than just not even being there at all. And just feel like you're
right.
not doing anything.
Right.
Yeah.
And you can, like, that helpless feeling can cause you to disconnect
Yeah.
and cause you to check out
We don't
from
want
the
to
labor.
do that. Yeah.
And you don't want to do that, because now you're abandoning your partner,
Yeah.
and they feel it, whether they recognize it consciously or not, they can feel it energetically. And
Yeah. I
so
agree.
it's important for you to find a way to stay connected to your partner, to be that support for them. Whether it's, you know, sometimes there's a position you can get up on the bed and you put your legs on either side of them and you support them from the back. You know, there's other positions that you can get in where they can, if you're sitting on a couch or the bed, your partner can be on the ground if they haven't had an epidural,
Yeah.
and they can lean. Their arms are draped over your legs, so they're in this kind of semi squat, but they don't have full pressure on their legs. So there's
Mhm.
a lot of different positions. Scour the internet and look at all the different partner positions during birth, and
Yeah,
practice
that's for
those ahead
sure.
of time so that
Yeah.
you guys are comfortable with it before the actual date.
Yeah, it's a good shot.
Listen to this podcast with your partner,
It's a good idea. It's a good
because your
idea.
partner needs to know this information as well. So let them know, I am a experienced pelvic health physical therapist that has worked with thousands of pregnant and postpartum clients, and I teach other body workers how to do this. And
Mm,
so these are the concepts, these are the things that you can implement prior to your birth, practice the pushing, practice the different positions, and figure out what feels comforting for your partner to do with you during your labor, so that he has something to do, or your partner has something to do during your labor to feel and stay connected to you in the process. Because I have to say, Chris, I just want
Yeah, tell me.
to something for dads to understand is that there is nothing worse than seeing your partner in pain and not being able to do anything about it.
Mm.
And birth can be traumatic for your partner, and it can also be traumatic for you. If the things get too intense, things don't go as planned, please know that there is secondary trauma in
Yeah,
witnessing your partner being traumatized and not
that's
being
so
able to do
true.
anything about it. And so we're trying to avoid that by setting themselves up, making sure baby gets into the best position possible, keeping their pelvis as even and symmetrical as possible, and learning how to push prior to the birth. All
That's so
those
true.
things are helping your partner to set themselves up for a smoother birth. So
That's so
please
true.
listen to this episode multiple times. Watch, listen to it with your partner, and implement as much as you can, and know that there is support by a pelvic health physical therapist. I have a directory on my website, instituteforbirthhealing.com. Please check it out.